networks. We will make electronic health records and claims data work for patients and researchers. We're already doing that, and always with parents in control of their child's health information. No family should have to fight cancer with outdated tools or without access to the very best science. For too long, families have fought childhood cancer while our systems lag behind. President Trump, thank you for your leadership in changing all that. This executive order is about action, unlocking cures, empowering families, and giving every child the chance to grow up healthy and strong. With American innovation and leadership, we can make our children healthy again.
Bobby, do they know why there's quite an increase that's taken place over the last number of years? Do they know why that? Do they have any idea why that's happening?
We are doing that research, and Jay Bhattacharya can talk about that. We're doing that research now for the first time. We're focusing on that, in particular colon cancers and these cancers that have that never affected children before, and suddenly are epidemic in our children. And we're going to find the causes, their environmental causes. We're going to identify them and work to eliminate them.
Okay, thanks, Bobby. Jay, go ahead, please.
Hello, thank you, everyone. Thank you, President Trump, for signing this historic executive order directing your administration to use advanced artificial intelligence technologies to cure childhood cancer. By signing this executive order, the administration is advancing the NIH Childhood Cancer Data Initiative's coordinated pediatric, adolescent, and young adult rare cancer, first launched under President Trump's direction in 2019. When I was a young medical student in the 1990s, I had the privilege of spending a month in a pediatric cancer ward treating children with cancer. And I have to say it was the most difficult month of my life. I left for home every day in tears. Watching little children cope with a deadly disease is hard. They should be playing with their friends, going to school, living their best lives. But instead, they bravely face cancer. These are the bravest kids I've ever met. I have tremendous admiration for the scientists who devote their lives to finding cures for kids with cancer, for the doctors and nurses who take care of them, and for their parents who suffer alongside them, care for them, and love them. This year, nearly 9,500 children will be diagnosed with cancer in the U.S. In the mid-1970s, the 5-year survival for cancer was 58%. Today, the cancer survival rate for children with cancer is 85%. This is because of the tremendous investments we've made in treating childhood cancer, in researching it. And it's worth celebrating this achievement. But I say that 85% is still too low. We need to be at 100. Whilst we still have a long way to go. The treatments these little kids undergo involve therapies like chemo, radiation, that put them through hell. Even with 85% will be cured, the therapies themselves can cause health problems as kids age into adulthood. Nearly 60% of cancer survivors experience severe life-threatening complications in adulthood because of these treatments. And so we need better treatments so that we can raise the survival rate and reduce the side effects. This initiative builds on the CCDI's mission to gather data from every child, adolescent, and young adult diagnosed with cancer, no matter where they receive care. It aims to develop a platform and tools to bring together clinical care, research tools like molecular characterization and genetic information, tools that will improve preventive measures, treatment, quality of life, survival for childhood cancer. By uniting families, clinicians, and researchers, by harnessing the power of AI, CCDI will accelerate diagnosis, inform treatment, and develop the next generation of life-saving therapies. This is not about collecting data alone. It's about giving families hope. Today, we commit to taking this work to the next level. With this executive order that President Trump is signing, we're building a future where every child's data contributes to faster diagnosis. Artificial intelligence helps us uncover faster, more precise treatments, improve quality of life, and better survival. And finally, let me extend my sincere congratulations and gratitude to President Trump for his leadership and vision in giving us this opportunity to make America healthy again, to rigorously push the boundaries of science and bring hope to millions of families. Thank you.
Thank you very much, Chair. It's very nice. Appreciate it. Director Kratsios, please.
Thank you, Mr. President, and thank you, Secretary Kennedy, for your leadership on this issue. I am thrilled that our MAHA strategy prioritizes utilizing AI in the fight against cancer, and that this executive order is putting a priority to this action. Thank you for your commitment, Mr. President, to the United States for maintaining its global leadership in artificial intelligence across models, data sets, applications, and to issue an AI action plan to do just that. Your foresight in the first term, leading you to establish the CCDI to gather, harness, and share data on childhood cancers has positioned us today to leverage AI in a way we could never imagine before. With America's pioneering models, American researchers now have the best tools in the world to turn the CCDI data into the building blocks of life-changing breakthroughs. So I and my team at OSTP are thrilled to partner with our teams at HHS and NIH and with David to empower the development of gold standard applications for the pediatric cancer research and to play our very small part in trying to protect the health and happiness of America's children. Thank you, Mr. President.
David, please.
Thank you, sir. Well, first of all, I just want to thank Stephanie McMahon and all of us for helping put this all together here. You know, for years they played villains on TV, but they're actually very nice people in real life. And but it's because of your passion that we're all here today. So thank you for that. And thank you, Mr. President, for your leadership on this. First of all, you did have the foresight to create this childhood cancer database way back in 2019, and that's what's going to power the AI. It's going to give us the data to find all the patterns in. The other thing you've done is you've made it your policy of this administration to support innovation, to support infrastructure, to support energy. And because of that, we have an AI boom going on right now. 3.8% growth rate in the last quarter in GDP, and a big part of that is because of the AI boom that you've unleashed. So thank you, sir, for doing that. And I think that we can see today that this AI boom is not just going to be about dollars and cents, but about saving lives as well. We're going to get some miraculous cures out of this. So thank you to everyone who's here today.
Good job. We just had a meeting, and Oz was at the meeting and really was a dominant factor along with Bobby. And maybe you could just say a couple of words about our past meeting where we're going to be lowering drug prices by 50, 100, 200, even 500%, even 1,000. We have 1,000% also. We have one coming up next week, a big one, 1,000% reduction in price. Do you want to give just a couple of words on that, Oz?
It's a historic day. For the first time, we've had the magnitude of give from the pharmaceutical industry. One of their leading lights, Alfred Boula and his company Pfizer, agreed, something the president has been pushing on since his first term and has been calling me quite frequently on speed dial over this term to make sure that Secretary Kennedy and I would seriously engage industry. They have agreed to several important concessions. First, we will have most favored nation drug pricing in this country for everyone on Medicaid. So our most vulnerable populations will not be forced to pay 3 times or more, 5, 6, 7 times more for the exact same pills in the same bottles as it costs in other countries. That will make it a lot easier for governors to manage their budgets and shows, again, a distinct passion that the president has for helping people who are most vulnerable. We've also gotten all new drugs to be released in this country to be priced at most favored nation, which means by the end of the president's term, 95% of all pharmaceutical drugs in America will be at most favored nation pricing. Again, no more discrepancies between what folks in other countries can buy their drugs for and what's being purchased in this country. Pfizer also agreed, as will companies next week when they come to visit this same White House, to onshore drugs to bring their production back into America so American workers will benefit as well. But at the same time, this is critical. It allowed Pfizer, and we believe for other pharmaceutical companies, to maintain their innovative edge. We want America to continue to find cures like the ones that saved the lives of some of the children that I'm looking at right now. Those beautiful faces and smiles are here because American innovation was not dulled, not blunted, but we can solve that need and thread the needle by also making healthcare affordable so Americans no longer, including children like this, be forced to make a difficult choice between groceries and pharmaceuticals. And I must say, Mr. President, since this morning, if you just look at the stock market, there's been support of this decision made by the CEO of Pfizer. Their stock has benefited. So I think it's the right thing for the company, the right thing for the policies of this administration, which is a pretty cool place to work. But most importantly, it's the right thing for the American people.
Thank you very much. And maybe we'll just finish it off with Linda, because she's been such an incredible cabinet member and done such a good job. Maybe you want to say something about your unbelievable daughter and son-in-law, because they've worked very hard on this.
Well, thank you, Mr. President, for the opportunity to do that. I don't think that, any mother could be any more proud of all of the efforts that Stephanie's made in support also of Paul. Stephanie first talked about this 10 or 11 years ago after Lil Connor. And I remember one of the things that she said to me was, I really would like to somehow convene the people and the scientists who think outside of the box, because research is done in very standard terms. You do this, and yes, you have to do that. But she said, I really would like to tap into some of the most creative and inventive minds in the country to be able to look at research differently for pediatric cancer. And she did that. It took her about 10 years, and she kept tapping in and calling people, being pretty relentless about it, driven herself by a mother's heart. And I couldn't be any more proud of the work she's done. I'm happy to stand by and be a supportive mom and be very proud of her today.
Thanks. Good job you're doing. Thank you very much, Linda. Okay, any questions, please?
Mr. President, as we inch closer to a government shutdown this morning, you said you might do a lot of layoffs. If DOGE is already reducing the federal workforce, why is it necessary to link more federal jobs cut to a shutdown?
Well, the Democrats want to shut it down, so when you shut it down, you have to do layoffs. So we'd be laying off a lot of people that are going to be very affected, and the Democrats, they're going to be Democrats. As you know, this country, no country can afford to pay for illegal immigration, health care for everybody that comes into the country, and that's what they're insisting. And obviously, I have an obligation to not accept that. That would affect everybody. You know, when I see what we're doing with AI and all the plants that are opening up in the country, $17 trillion is coming. And if you compare that to Biden, Biden had, in 4 years, less than $1 trillion. We have $17 trillion, more than that. I think it's going to be much more than that, David. By the end of this year, I think it's going to be far over that. It's a record. It's already a record in 8 months. It's a record by a lot. And so we're doing well as a country, so the last thing we want to do is shut it down. But a lot of good can come down from shutdowns. We can get rid of a lot of things that we didn't want, and they'd be Democrat things, but they want open borders. They want men playing in women's sports. They want transgender for everybody. They never stop. They don't learn. We won an election in a landslide. They just don't learn. So we have no choice. I have to do that for the country. Yes?
You mentioned a deal with Harvard, Mr. President. What is that deal? Will they be paying the administration?
Well, we're in the process of getting very close, and Linda's finishing up the final details, and they'd be paying about $500 million, and they'll be operating trade schools. They're going to be teaching people how to do AI and lots of other things, engines, lots of things. You know, we need people in trade schools. I remember when I went to school, I had some people that weren't particularly good students, but they could take a motor or an engine apart blindfolded and put it back blindfolded, but they weren't too good at other things, and many of them ended up doing better than the people that were. So trade schools are very important, and we've lost trade schools. We used to have a lot of trade schools in this country. We don't have them anymore. We have tremendous plants opening, and we want to have people at top level for those plants, whether it's AI or whether it's automotive plants. You know, we have many automobile companies open their plants in the United States. They're all coming back for two reasons: tariffs, and I think they liked November 5th. You know, they liked the person that was chosen, and they're moving in from Canada, they're moving in from Mexico, they're coming in from all over the world. China is coming. They're all coming, and that way they avoid paying tariffs. So, you know, they're coming for that reason. So by opening up trade school, because we're going to need employees, we're going to need people with skill. And I think I can say, Linda, you feel the same way. By opening up trade school, this would be a giant trade school, series of trade schools. It would be run by Harvard. Now, this is something that we're close to finalizing. We haven't done it yet. But they put up $500 million. Interest and everything else would go to that account, meaning go to the trade school. And, you know, it's a big investment in trade school, done by very smart people. And then their sins are forgiven. So we have a good chance of getting that close. Yeah, please.
Mr. President Trump, thank you. I've been looking at this chart that you showed us earlier, so it's left over on us earlier. U.S. prices for brand drugs are 422% higher than comparable countries. You know, I'm young, maybe I'm inexperienced, but I think a lot of Americans are wondering, how did we even get here being one of the biggest buyers?
You got here by incompetent people sitting behind this desk. You had a lot of incompetent people. I did it, as you know, I started it in my first term. We rebuilt the military. We got the largest tax cuts in history. We did all these things, and we had the best economy in the history of our country during my first term. And by the way, this is blowing it away based on what we're seeing. But we got it by having people allow that to happen. And as you know, I started the process, but then when COVID came, we focused on COVID, not on this. And I said, if I ever go back and do it again, I'm going to make this a primary thing because other countries are paying a fraction of what we pay for the same exact drug, same exact pharmaceutical, everything. And I said, no, it's not right. And the drug companies actually came along. You know, don't forget, they make 30, 40, 50 million a year, these people. They're very smart. And they had a lot of people convinced that, you know, that's the way it has to be. They talked about research and development. We had to pay. I said, well, why isn't Germany paying? Why aren't other countries paying? And they always had a good answer, but it got to a point where I didn't like the answer anymore, and I said, we have to do this, and we did. And the team that we have with Oz and Bobby and Chris and all of the people that we had working on it, and I must tell you, Marty's been a big, wherever you may be, Marty, but Marty's been a big factor. We have a great team. There's never been a medical team like this, and I said, let's go do it. And then I did, as I said, I would bug them every single day, every week, because I said, we have to have, I mean,